Hi everybody, I'm Dr. Sanjay Pandey, consultant urologist at the Kokilabhen Dhirubhai Ambani Hospital in Andheri in Mumbai. Today I would like to speak to you on gender reassignment surgery, a subject which has now been taken to very high levels of management at the Kokilabhen Hospital by a multidisciplinary teamwork that we practice in this institute. Gender reassignment surgery is for transgender individuals who are labeled as gender dysphoria or gender identity disorder by a set of two psychiatrists and psychologists who help us in identifying the right patients who deserve the therapy and helping them to come out of entrapment. Gender reassignment surgery is actually started when the patient who is quite focused and who has been living a dream to come out of entrapment, being a transgender individual, attempts to come out of the entrapment that he or she is going through and may not be able to tell, possibly her parents and her peers, and lives in this agony since her adolescence and since years, hopes and prays that I could find a doctor or a team who could help me to come out of this entrapment. Now, transgender individuals are not abnormal individuals. They are individuals who deserve respect, the individuals who deserve the same space that I and you actually have in the society. It is important that we identify them as normal individuals and give them the right platform and the right space. They are as competent as you and I are. It is important that we also identify the transgenders in time so that they don't go through the trauma that they've already gone through mentally on their own or possibly with societies across the country and the world. Gender dysphoria or gender identity disorder, as labeled by WPATH, is a situation where the brain wiring has gone unfortunately wrong. As a result of which, the phenotype and genotype, though being normal, that means an individual has got a normal body, normal sexual characters, normal secondary sexual characters, normal mind, and a normal competence in the society, always feels entrapped and says, why me? Why am I entrapped in this body which has been given to me? I probably seek to be in the body which I don't have, and who could help me out? So probably lives in the agony of looking at how, when, where will I get a situation where I'll be able to come out of the entrapment. The gender clinic at the Kokilabhen Dhirubhai Ambani Hospital, which we run at this point in time, is a multidisciplinary team where a team of psychiatrists, endocrinologists, plastic surgeons, gynecologists, a gender board, and a legal backup helps me to perform this gender reassignment surgery with a team, with the colleagues who actually have understood the subject and taken this forward to the society. We go on a drive and help our colleagues in general practice, our colleagues in gynecology, our colleagues in various other medical fraternities understand that this is not something very abnormal. It's a part of the society like in other Western societies, and we need to give the right pedestal for the transgender individuals to take their possible step towards coming out of entrapment. Once having identified the right individuals, we take help of the psychiatrist, at least two clinical psychologists, psychiatric team, which helps us and identify in extensive psychosomatic evaluation those patients who would be able to help us out to identify the right patients. I remember a few of these patients who actually had seen us and were very focused and had come from different parts of the country and the world, were actually put down by psychiatrists and psychological teams saying that they are not yet completely mature to take the subject forward. That means they are still in evolution as transgender individuals. They need to be given more clinical and sexual counseling. Clinical psychological counseling is required in such patients. They need to be helped over the years till they can actually be taken up and labeled as gender dysphoria or gender identity disorder. It is of prime importance right now that once we have identified such patients, by the 7th version of WPATH, that we give them the proper hormone therapy to give them that female to male or the male to female initial conversion or initial reassignment. It helps them to come out of the entrapment. They feel quite good. They've already been living and they only look as their new individuals that they have thought about preparing themselves for the future. Once the hormone therapies are on, we look forward to such patients now understanding that they could follow their journey beyond hormone therapy to go and undergo various kinds of reassignments. Like a male to female gender reassignment to me is a single stage, state-of-art, penile inversion vaginoplasty with a neoclitoris formation, a neocervix formation, giving a neourethra or the neomaters, and making them a single stage 4 to 4.5 hours of surgery where we make them a male to female. They are capable of removing their vaginal mold over the next 3 to 5 days. The urethral catheter comes out over the 7th to 9th day, and they are reassigned as a male to female single stage reassignment. These patients do very well with vaginal calibration, vaginal dilatations over the next few months. We all know that vagina is a wound which has been created between the urethra and the rectum, and it's important that we keep this by volume dilatation. Obviously, we all know coitus is the best way of volume dilatation in these focus individuals, but in due course of time, they would have to keep their vagina dilated and to keep them to that kind of capacity both in length and in the girth called the circumference. The female to male gender reassignment surgery which we practice are of two kinds. One of them is called metoidioplasty. Metoidioplasty is an amazing surgery where those focus individuals who want to become a female to male undergo this surgery as a single stage surgery where an enlarged clitoris, which actually has been enlarged by the hormone therapy over the last 3 to 6 months to a year since the patient went on hormone therapy. An entrapped clitoris, which is a female penis, is brought out of its entrapment. This can actually gain anything between 4 to 6 centimeters in those individuals, depending on the kind of surgical expertise we have. And we then bring about a urethroplasty, vaginal closure, and letting the patient having a micro or a mini penis or a penis of 4 to 6 centimeters, depending on what this patient can be given. Two testicular processes are placed at the end of the surgery, and these are all patients who look like adolescent males. So they have a penis, which is what they wanted. They wanted this penis not to be able to be sexually active to have a coitus or active penetrative intercourse. They actually want this to be able to stand and pass urine in a male toilet. They want to look like a male. They want to feel a male. They have got everything out there, which are the two testes, the artificial testes, testicular processes, and they've got a penis which is sensate. It has got all the sensation. Remember, it's a female penis or a female clitoris which has been converted to a male penis, and the urethra is brought to the tip of this clitoris of the new penis. So this stands very tall for a lot of focus individuals who are not looking at any kind of a situation or a surgery where they want to come out of entrapment to be sexually active. They want to gratify themselves by self-stimulation or by masturbation. They could do that by this sensate organ, and they will have the two testes. Many of these patients are actually on a vacuum erection device therapy for future, which allows to prevent a fibrosis that could set in and entrap this penis, which helps their testes to hang around and look like an adolescent male. They finally would be standing and passing urine in a male toilet and would come out of entrapment. The other focused female to male individuals demand and deserve a phalloplasty. That's what they've been aiming for. They want to convert themselves to a male, which actually could have a long phallus, a phallus of desire, which would be a sensate organ, which could be an organ that could be able to get an erection capable enough to perform an active penetration in a normal young female who could be a partner. This could also be a situation where they would like the phallus to have a urethra at the tip. This is many a times a multi-stage surgery, except the radial forearm flaps, which are a single stage surgery where we incorporate a urethra, a tube within tube, where we also incorporate a semi-rigid erection device or rigid processes inside that. We prefer latissimus dorsi flap and ALT flaps. These are flaps which allow a penis, a sensate organ to be created, which the patient now learns to live with it. And therefore, in other stages, we would create a glans, we would create a urethra, incorporate erection device or a semi-rigid prosthesis, and would let this patient function as an active male in due course of time. These female to male individuals also have undergone their breast surgery, undergoing bilateral mastectomy, and have in due course of time undergone hysterectomy and oophorectomy. It is very important that as a transgender surgeon, being a urologist and andrologist, I need to take these patients to logically conclude them and give them a certificate that they've undergone a gender reassignment surgery, a surgery which helped them come out of entrapment. I'm closely associated with transgender individuals in terms of meeting their peer groups, understanding them, taking active participation in rehabilitating them back in the society, the certification, the name change, and helping them to come back to life. They don't face discrimination in society, they get back jobs they seek and they have lived for. They are rehabilitated back in their family, which would initially may not be able to accept in a society of ours like India. They take pride in as a family, and it's so nice to hear that in 21st century India, many of these families are taking it up in a very proper way. It was quite a dream years ago, 7-8 years ago, when we started this whole project, and when I trained myself from a reconstructive urologist into gender reassignment, that we be able to bring this subject to such high levels in India, to be able to keep their secrecy, to be allowing them the platform that they deserve if they wanted to go to media, to give them the proper surgeries, and obviously to explain to them everything, which could be the complications of surgery, the timelines required, the cost that could entail in these kind of prolonged surgeries, the visits that they required. And I must thank Kokilabhen Dhirubhai Ambani Hospital the chairperson, the management, the team that has actually backed the entire project, and the staff, especially the nurses and the junior medical fraternity who have actually taken this subject quite in a stride, because this is quite a new subject to the entire society of medical fraternity. We all have not been trained about this during our medical curriculum. We all have evolved to come and understand that this is probably a stigma in the society. It not at all is. It's actually not an enigma anymore. We live and work and help transgender individuals to come and realize their dream at Kokilabhen Dhirubhai Ambani Hospital. And proudly so, this happens to be one of those best multidisciplinary teams in the country, taking care of a lot of individuals from various Asia Pac countries, Britain, United States of America. We had patients coming in from Orlando, from Birmingham, from Kuwait, from Oman, from Dubai, from Philippines. And I would allow patients to be coming in here and seeking help, asking questions. They are already very focused individuals. Let me confess that transgender individuals do a lot of years of research very silently, and they know a lot. When they call me up on my telephones at odd hours and seek an appointment, I know they are quite well versed with the subject, need not explain to them everything. It's only the fine-tuned medical aspects that we need to explain to them. So gender reassignment surgery has come of age. At the Kokilabhen Dhirubhai Ambani Hospital in the Department of Urology, we have taken this to heights as a team of urologists back in this institute. 3 of us, including our junior medical fraternity, our nurses who are trained and understood this subject. We are quite proud to be able to take these subjects to height. More and more transgender individuals have got their dream realized in our institute, in our department. And I must thank the anesthetists and the whole team of anesthesiologists who have actually taken this subject quite properly. They have actually allowed these patients to understand that anesthesia is so safe, they can undergo prolonged anesthesia. And hats off to everybody who has actually been a part of this team. Thank you so much.